So we were discussing for selection of the lasers, you have to identify what type of patient we are choosing. So the patient selection is vital. Second, you have to set the parameters of the lasers. You have to choose the ideal skin type. For lasers, the ideal skin type is usually between 1 to 3 type classification of the skin. Darker skins are more prone to burns. Age 35 to 70 is the ideal age for laser treatments. Again, while doing the laser treatments, you have to see that the patients don't have skin infections, are not on retino treatments or steroid treatments on their skin, which may affect the outcome of the result outcome by the lasers. So how many number of passes of the lasers you have to give? Again, you have to understand. Like first pass will just remove the epidermis. The pink dermis layer will be exposed in this. The second pass, if you need to give a second pass, it will remove the papillary dermis, that is the yellow dermis will be exposed. Additional passes might be required as per the diagnosis and the condition of the patient. Again, the post-op care is necessary for this after you do the lasers. In detail, we'll discuss later, but in brief, I'll tell you, you have to keep the raw surface moist. You have to use dressings and ointments and antibiotics, and if the skin feels dry, you have to keep it moisturized. So first, let us go with the first laser that I'm going to teach you is about the IPL, that is intense pulse light laser. Now, intense pulse light laser, you have from portable variety to stationary varieties in this. So depending upon your budget, you can invest into this. This laser has been successfully used to treat majority into for laser hair removal, that is unwanted hair on your skin, but this acts only on black hair. Laser itself is attracted to black pigments or filaments all over your body. So white on white hair, laser is not effective. It is also used, IPL is also used to remove ingrown hair or razor bumps, which is folliculitis barbae. You see that when you shave, you see small infections and hair pointing out of those bumps. So this is also associated with skin darkening and pimples around there. IPL is also used in rosacea. It is used in treating facial blood vessels, including port wine stains and hemangiomas. Also for freckles and skin darkenings, where you can do phototherapy. For sun damage also, where you can do phototherapy using different filters. Wrinkles, it induces skin rejuvenation by phototherapy. So it is also reducing the appearances of fine lines on your face. Mild, elevated and depressed scars can also be treated by IPL. In acne, it reduces by blue light. It reduces the bacterial proliferation and retards and arrests acne. How IPL is different from this other lasers. So this is a pulse light laser which has a green light, a yellow light and a red light filter. Laser light starts from pulse light. This laser comes from this pulse light laser but eliminates all in one wavelength or color. Laser can deliver only one color or one wavelength at one time. So you have to choose your filter accordingly to what treatment you are going to impart to your patient. So for hair removal, you usually go about 700 to 1200 nanometer wavelength. It begins actually from this pulse light has wavelengths from 500 to 1200 nanometers. So which includes like 500 will start from green, then it goes to yellow, red and infrared lights in different wavelengths. So 550 nanometer cuts off filter blocks light from 500 to 550 nanometers. It allows only this range of wavelengths to pass through it. Other wavelengths are blocked. So the filter will give, the laser will give all types of colors, but this filter will block other wavelengths and will allow only wavelengths from 500 to 550 nanometers. Understood? So wavelengths can be customized to reach a specific target of hair or blood vessels or any skin component that has to be treated, and it can be modified by each pulse. So you have to keep the TRT and pulse duration in settings according to what you're treating.